Right. So good morning, good afternoon, and good evening, everyone. And welcome to this webinar on deep dive webinar on integrating health and nationally determined contributions. My name is Elena Zotova. I work with the Climate Change and Health Unit at WHO. So let's begin with a few housekeeping before we dive into this webinar. So today we do have interpretation. You have the instructions on the screen to access interpretation. And this first session, we will have French, Arabic, and English interpretation. You should have the button on the bottom right of your screen in Zoom. And if you're not able to see the interpretation feature, just click on the three dots that displays more to access this feature. We do have two sessions today, so this one and then another one later at 3 p.m. Geneva time. Both sessions cover almost the same content, so if any of your colleagues are not able to join this session, or they can join this afternoon session, or there is no need to join both sessions. We will also record both webinars and make them available on the WHO website for those who couldn't join. And to all speakers, we kindly remind you to also use a headset for your interventions to ensure good audio quality for interpretation particularly. And if not possible, please do speak close to your microphone. Now we've set this webinar up as a Zoom meeting rather than a Zoom webinar so that we can all engage and discuss, particularly in the discussion and Q&A session later. But we do kindly ask you to stay muted when you're not speaking, and do feel free to use the chat and Q&A functions so that we will respond to the questions as much as possible if time permits. So let's dive into the webinar. So this is an overview of our webinar today. Today's session will be focused on exploring the opportunities and processes for incorporating health and nationally determined contributions. This is based on the WHO quality criteria for integrating health into NDCs, which was launched at COP28. And today's webinar follows a more general session we had on health and NDCs in last September. So we will start with some opening remarks from the Wellcome Trust and WHO, followed by a few presentations from experts from UNDP and WHO, on tools and approaches that can be helpful to integrate health and NDCs. And we will follow with a few country experiences on integrating health and NDCs. And finally, a discussion and Q&A session where you will have the opportunity to interact a little bit. So without further ado, I would like to pass it over to Dr. Rachel Huxley from the Wellcome Trust for the opening remarks.
Thank you very much. So my name is Rachel Huxley, and I head up the work that we do at Wellcome around mitigating greenhouse gas emissions and maximising health co-benefits. And that work is part of our climate and health priority. Thank you. First of all, I just wanted to start by thanking you so much for asking me to provide some short introductory remarks. But more importantly, I wanted to thank WHO for all the work that you've done and you're doing at the intersection of climate and health. The agenda today is fantastic, looking at all of the various speakers, and it's fantastic to see so many people participating. So this is a really important discussion. Thanks for inviting me to provide some remarks, but more importantly, thanks to everyone here for having it. I also wanted to sort of start by recognizing that it's a particularly difficult time for those of us working in climate and working in health. The world's become increasingly chaotic, and the environment in which we're all trying to do our jobs has become increasingly difficult. So really appreciating again that people are making time for this, and that we're still finding time to sort of progress this really important agenda. And that latter part is really critical, because it's through action and through progress that we can provide hope in these difficult times. And I think the progress that we're seeing on nationally determined contributions, although not as fast as we would like, it is progress, and that process is working. We're seeing ambition ratchet up. And although, as I say, it's not as fast as we would like, we are in a much better place now than when I started working in climate over 20 years ago, when we were on track. I think it was for 4 or 5 degrees of warming, and now with policies, if they're implemented, it's around sort of 2.4. So we're in a much better place, although we still need to get it lower. And I think we've gone from a situation where we had to talk about what climate change was, to then arguing that it was real, to now having a sort of conversation about how fast and how quickly we can do this. And the backlash that we're seeing, as unpleasant as it is a sign of our success and how far we've come. So in terms of the role of health in that climate journey, at Wellcome, excuse me, at Wellcome, we strongly believe that health has an important and central role to play in this round of NDCs. As always, it can help in a myriad of ways. So NDCs provide a great opportunity for thinking about the range of ambitious climate action that we need to implement. And that climate action has a range of health benefits. And if we bring health into the NDC process, we can make sure that we maximize the wins for the planet, but also wins for people. And those kind of co-benefits across clean air, across healthier diets, across increased physical activity, to name the 3 sort of major wins. As well as more resilient cities and health systems. So there's a whole spectrum of health impacts and potential benefits that we can gain from thinking about health and climate together in the NDC process. And we also know that health can raise ambition. At a time when climate change and climate ambition is under threat, health has a really important role to play. So we know that people really care about health in a way that is more real and is more tangible to them than talking about climate change. And bringing health into the NDCs makes the process not just about targets, but about people and about our quality of life. And that helps build support from the public. It helps create political momentum and political space to act. And it's something that everyone can relate to across the political spectrum. And that's really needed today more than ever. And including health is also really important from the perspective of making sure that we have a just transition for everyone. We know that climate change is going to impact on everyone's health and well-being, but it will impact on the most vulnerable. We'll see great inequities between countries and within countries. And it's really important that when we're thinking about NDCs and we're thinking about climate action, that we make sure that we think about health equity and how that we build a healthier, fairer, and more equitable future for everyone. And failing to consider health within climate action risks worsening inequality and worsening outcomes, and exacerbating existing health challenges and creating new ones. So it's really critical that we bring health together with climate, because that time of one-dimensional thinking is over, and we've seen the mistakes that having sort of single thinking policies can bring us in terms of some of the policies around climate that have not been beneficial for health and vice versa. Yet when we bring the two together, we can be much stronger. So we know that time is of the essence in terms of climate change. Everything's urgent and everything is critical, but this next round of NDCs is particularly critical. Our window to keep the Paris Agreement aspirational target of 1.5 degrees alive is fast closing, and it's a really important target to keep hold of and to keep in sight, because the difference between 1.5 and 2, and indeed every 0.1 of a degree, makes a big difference to the impacts of climate change on health. So it's incredibly critical that we keep working and pushing on climate change, and health is a very, very powerful driver to do that. So I think really just wanting to say thanks again, everyone, for being here, how important it is to keep this conversation going, and how important it is to bring health into the next round of NDCs to pursue that ambition around 1.5. Thank you very much.
Thank you, Dr. Huxley, for these inspirational opening remarks on behalf of the Wellcome Trust, and really helping us understand the context in which we are doing this work of trying to integrate health in NDCs. Now, I would like to pass it over to Dr. Diarmaid Campbell-Landrum from WHO for opening remarks on behalf of the World Health Organization.
Thanks so much, Lena. Thanks to the team for organising this meeting. Thanks also to the Wellcome Trust. Thanks, Rachel, for those remarks, and repaying the compliments that you gave to WHO back to the Wellcome Trust, who have been absolute champions of integrating health and climate for stronger action for people around the world. Yeah, it's a real pleasure to talk in this really important meeting and to see people from joining from around the world. And the reason that we think this discussion is so important is one thing that presumably everybody who has joined this call already agrees on, is that huge important interaction between climate change and health. Both the threat that climate change poses to health, but also, as Rachel has just alluded to, the huge health opportunity that comes from actions both to increase resilience, but also particularly to mitigate climate change. And of course, that's what the NDCs are all about. They're effectively the commitments that countries are making to their own, to the world to protect the climate, but also effectively to their own populations, that their countries will do their bit to address the climate crisis, to protect them. But also this important dimension that we and others in the health community have been bringing to the fore for some time, is that it is actually a huge health opportunity for countries and for local populations to take actions that are ambitious on climate. And Rachel has just alluded to several of these, that the actions that we need to take to avert the climate crisis through mitigation are clean energy systems. They're more sustainable and healthy urban transport systems. They're sustainable and healthy diets and food systems. And those are potentially huge wins for health if we do them right. So there's absolutely the evidence that we should be bringing these two agendas together. And WHO it's part of what we do is to document the evidence for these things. In the latest investment case that WHO put forward, we outline just a few of the interventions for which there is really good evidence on the benefits of climate and health actions, both across resilience and also across mitigation. And the conclusion there is that if we do the things that we already know work, we could save about 2 million lives a year, which is comparable to anything else that we can do in global health. So the evidence is that the opportunity really is huge. The other thing that we do from WHO, one of the other things that we do is to track the extent that countries are taking that opportunity. And so we've reviewed the content of health within the INDCs, the initial nationally determined contributions, and then the next round of NDCs. And we see real progress there. We see countries going from the first round where only about 10% of countries mentioned health. I think only about 1 or 2 actually quantified those huge health benefits that we know are there in the initial round. And that has moved dramatically forward in the next round, where about half of all countries, I believe, mentioned health in their next NDCs, and a good proportion now are starting to quantify those huge benefits. That quantification is important because we know that the potential health gains are so large that they actually pay for the cost of mitigation. And they're also locally relevant as well, because it's about improving the lives of your own population. So that's one of the reasons that we engage so strongly on this issue. And we're also making progress both in elevating health within the climate discussions. We've had the first health commitments under a COP presidency initiative, starting with the UK in 2021, the first ever climate and health ministerial at COP28 in Dubai. Over 150 countries have signed a climate and health declaration that connects very closely to this agenda. So we're seeing and helping to drive progress there, but we're also doing the same on the health side. So last year at the World Health Assembly, countries approved a new World Health Assembly resolution on climate change and health. This month, the countries will hopefully endorse a new global action plan on climate change and health, which describes what countries should do, what the WHO Secretariat should do, and what others should do to drive forward this agenda. And including health within NDCs, within national adaptation plans is there. I would also say that we at WHO, also in proposing the global health agenda for the next 5 years, have elevated climate change to be the first of only 6 strategic priorities for the global health agenda. So again, it's absolutely pushed front and center. So we need to be able to support countries to take advantage of that, integrating health in NDCs. And I think you'll hear from our colleagues in UNDP in a moment, who are leading the coordination of the overall UN system effort to include, to support the NDCs. And in WHO's case, that's bringing the health expertise into the door that they're helping to open and to facilitate. And you'll hear more during the seminar, particularly from Dr. Savage, about the guidance that we provide, the quality criteria that we provide, the tracking services that we provide, and also the technical support that we've been able to provide in some detail to a few countries to do deep analytical work around the health benefits of including health in their NDCs, in fact, with the support of the Wellcome Trust that you've heard from earlier. So with that, I'll just once again welcome you all to the webinar. I'm looking forward to interesting discussions, interesting presentations from countries and other technical partners, and working together for progress on this issue. So back to you, Lena.
Thank you very much, Diarmid. So now that we have set the stage for this webinar, let us hear from Mrs. Marina Smelanskaya from UNDP on the UNDP Climate Promise as a key initiative that supports countries in enhancing their nationally determined contributions. Marina, over to you.
Thanks.
And I understand that, yeah, please feel free to share your screen with the slides. Thank you.
Oh, do you mind doing that for me, Alona? Because I didn't prepare.
I can do that, Marina. Just hold on a moment.
Sorry. Apologies. I can start in the meantime just by greeting everybody. Thanks for being here today, and thanks to WHO colleagues for inviting us and also for their leadership. I also think it's a little bit just a slight correction to the program. It says UNDP Climate Promise, but we really think of the Climate Promise as a UN system coordinated support to the NDCs. So not really something of ours, but something that we share with everyone and with the stakeholders. And I think huge thanks to Dr. Huxley for the intervention. I think it's especially an urgent time now, during this time of political uncertainty, funding constraints, and the pace of climate change accelerating. Nevertheless, it's a really urgent time to coordinate and to work together so that we can provide clear, streamlined support to countries and with country stakeholders. So if we could go to the next slide. And I will talk a little bit about the climate promise, of course. Sorry, it's asking me which language I'm speaking. Just give me 1 second. Okay. So I think Diarmid has addressed this already. Why should health be a part of NDCs, of these climate pledges that countries are making, and why do we need UN-wide support? Climate change events are accelerating. Storms, floods, and landslides caused over 2 million deaths in the last 50 years, and over 90% of these deaths are occurring in low and middle income countries. And under the current trajectory, we can see that about 2 billion people will be exposed to severe heat by the end of the century, with the global south, especially Southeast Asia, being particularly vulnerable. We also know about the premature deaths that are being caused by air pollution. As a large city dweller, I can confirm that that is indeed a huge risk, and reduced air pollution is an important co-benefit of climate action. It means less disease burden, respiratory and otherwise, reduced mortality and morbidity and healthcare costs. As evidenced by multiple studies, data, and so on, developing countries are and will continue to be disproportionately affected by the health impacts of climate change, along with the related economic, environmental, and social challenges. And that is why it is so essential to coordinate across UN agencies, but also across sectors. If we could go to the next slide. So what is the climate promise? It's originated and was launched 6 years ago, indeed, by UNDP. But again, we're really calling for agencies, for countries to work together. And so far, it's supported over 85% of all NDCs 2.0 submitted by developing countries. As a result, we've seen over 90% of countries raising mitigation ambition, over 90% enhancing adaptation, 96% including gender, and 97% addressing youth, which is important around the issues of equity that our opening speakers have remarked on. Overall, we've seen with the support from UNDP and other stakeholders, the results have led to NDCs that were higher quality with better data and details of costing, because we see that as a really important part. You can have a plan, but if you have no resources and finance to support that plan, it is futile. If we could switch to the next slide. Why do we coordinate the NDC 3.0 development as a UN agency? So last year, the UN Secretary General stated that ambitious NDCs were a priority for the whole UN system. And there's a wide agreement about this across the past and current COP presidencies. Given that we as UNDP have the largest climate portfolio across the UN system, and because of our on-the-ground presence in 170 countries and mandates across the variety of sectors, it made sense that we would lead UN coordination towards NDC 3.0. So one of our strengths as more of a generalist among the UN development agencies is our ability to support coordination and governance across existing initiatives and programs. In order to be impactful, we feel like that the NDCs have to be linked to other global, regional, and national efforts, including the SDGs. And if that is done, the NDCs can reach beyond climate action and be one of the strongest tools to advance sustainable development, which is one of the UNDP priorities. Now, in 2025, the goal of the climate promise is to support developing countries to align the third generation of NDCs to the goal of the Paris Agreement, strengthen their quality and investability, and accelerate their implementation. Currently, over 100 countries are being directly supported through close coordination with all UN agencies and with many other partners, including civil society, private sector, academia, and others. We've been hearing and seeing that countries are taking longer to submit their NDCs, but we feel that it is evidence to the fact that they're of higher quality and that they're critical pillars and connections that are being considered by country leadership. If we could switch to the next slide. So the guiding principles of climate promise are ambition, acceleration, and inclusivity. Again, things that were discussed in our opening remarks. Acceleration means scaled implementation through access to technical support and finance, public, private, international, and national. Inclusivity is important in the context of health, as it refers to strengthening human rights and whole of society approach. And then ambition, of course, refers to higher quality NDCs with political will, strong targets, and alignment with other development frameworks. We could go to the next slide. So let me also explain who the key actors of the climate promise rollout are. So first, it's the UN system that has developed several resources that support the progress on the NDCs. This ranges from data to policy advice and deep dive technical and analytical support for multiple agencies, including the webinar that we're on today, including WHO, FAO, UNICEF, ILO, UN Women, and many more. UNDP offers expertise in 15 sectors such as gender, human rights, energy, adaptation, nature, and circular economy. Last year, health was added as one of the support areas. So as UNDP health team, we have been able to provide direct support across our areas of work, including climate resilient and low emission health systems, air pollution, nature and health solutions, and overall integration of health considerations. NDC partnership also plays a critical role in coordinating and matchmaking NDC support across the various implementing partners. It's a global coalition of almost 250 members to facilitate climate action and sustainable development. NDC partnership developed an NDC 3.0 navigator, which is a one-stop shop for all thematic and technical guidance for countries on how to undertake an impactful NDC review. There's also regional economic commissions that participate in the support by offering platforms for exchanging knowledge and support regional issues. And lastly, the UN resident coordinator system and the UN country teams provide a national platform for coordination. If we could move on to the next slide. So how do these actors concretely support the NDC development at the country level? First, the team helps the country to stock take of the past NDCs and their implementation. This is the analysis of the progress towards the pledges previously made. And then the team identifies the needs and opportunities for the enhancement in the NDC 3.0. Oh, excuse me. The country support team also supports advocacy and outreach through coherent and strong messages that the governments can benefit from, and communicates the latest science to encourage evidence-based decision-making. And of course, the science is coordinated across agencies. We just heard WHO kind of provide, or I think we will hear more from WHO on providing the recent evidence and so on. Then sharing of information on solution happens, successes and experiences are listed, and this helps generate momentum and demonstrate what is already working. And lastly, targeted in-country technical support and capacity building on NDC enhancement is provided to countries from across the UN member states. This element focuses on coordination, target setting, policy alignment, and costing. The NDCs must unlock finance and be investable. So the support for countries will also drive multiple sources of finance. Once the NDC is developed, the Climate Promise support team will continue coordinating support to the implementation phase. If we could go to the next slide. So I think this is a lot of information and somewhat technical details, but I hope that I'm going to leave you with the understanding that the Climate Promise is a tool that any country can benefit from, as it offers a variety of support to choose from, and that it's a collaborative effort. Before I give the floor to the next speaker, I wanted to say a few words on how UNDP has already supported the integration of health into the NDCs through the Climate Promise. So as mentioned, we have offered official support under the area of health as UNDP. So any government or country team willing to improve the health elements can benefit from our team's help. We work with WHO and various health groups at country level to jointly support this. We've noted that this time, during this process of NDC review, there's much more awareness of the need to integrate concrete health actions, which is fantastic, but many governments still have questions around how exactly to do this. I think we will hear an example from Nigeria on how they're approaching this question. A specific area of support that UNDP team targeted this year has been around integrating air pollution and black carbon into the NDCs. Given that air pollution is becoming the biggest environmental determinant of non-communicable diseases, we see the urgency to reflect that in the NDCs. With support from the Clean Air Fund, we have reached out to countries with severe air pollution burden and offered our help. And countries that have accepted this offer include Ghana, Tanzania, Georgia, Nepal, and Vietnam. With this, I'm going to finish my presentation. I just wanted to say that we have seen fantastic collaboration at the country level from both government actors and cross and multiple other partners who are supporting the development of these pledges. But I think another point that I want to stress is the end is that what really matters is country ownership and leadership on these issues, especially in the environment that we're currently in. Thank you again, and I'm done. Thanks.
Thank you very much, Marina, for explaining how the Climate Promise initiative works and the support available to countries to enhance and finance their NDCs. So now let's hear from Dr. Amy Savage from WHO on some more specific strategies that countries can use to integrate health into their NDCs. Amy, over to you.
Sorry, just having some technical issues. Thanks, Lena. Let me try and share my screen again. Now, can you see my screen? Let me just put it in presentation mode. Okay, does that work?
Yes, but we don't see the title slide yet. Now, yes.
Perfect. Okay. There always has to be some technical issues. Thanks so much, Lena. And thank you to all the speakers previously for setting the scene and highlighting why we're doing this, why it's important to integrate health into the nationally determined contributions. In my presentation, I'll take it down a notch, a little bit more into the weeds, and I'll provide an overview of our recently launched guidance, quality criteria for integrating health in nationally determined contributions, and provide an overview of some of the opportunities within the NDC process and within the NDC documents and targets of where health can be integrated. So just as a quick overview, what are the nationally determined contributions? Well, the parties of the Paris Agreement we know are requested to develop and submit nationally determined contributions, or NDCs. And these are the national plans that outline a country's ambition and progress in climate action to contribute to achieving that long-term goal of the Paris Agreement, which is, of course, to limit global warming to 1.5 to 2 degrees above pre-industrial levels. And these plans are based on national circumstances, capabilities, and priorities. So health has a role in UNFCCC processes, and there is also significant opportunity for synergy among these various processes. So you can see in this slide just a brief overview of some of the UNFCCC processes. And while the NDC process and the UNFCCC other processes are usually led by Ministry of Environment or Climate Change, ideally the health components or the health inputs are led by Ministry of Health. So for NDCs, for example, ideally it's the Ministry of Health that's setting those health sector mitigation and adaptation targets and priorities, and then along with the health community contributing to the overall NDC development and implementation process, and crucially working with key health determining sectors to make sure that their adaptation and mitigation actions consider and maximize health gains. So this slide just shows the NDC ambition cycle, which represents the efforts for countries to strengthen their national climate efforts over time. So as we know, NDCs are submitted every 5 years to the UNFCCC Secretariat, and it is expected that each subsequent NDC is a progression or increase in ambition. So I'm sure we're all aware that parties are requested to submit the next round of NDCs this year, and then every 5 years after that. It is also important to note that countries can modify their existing NDC at any time to increase its ambition. And you can also see here the global stock take. So we know that one was done in 2023, and they're done every 5 years to assess the collective progress towards achieving the long-term goals of the Paris Agreement. And hopefully we use that information to modify and enhance the NDCs and the ambition within those NDCs. So you might be familiar with this figure. We've shown it in a few other presentations, but essentially it is showing the overarching focus areas for building climate resilient and low carbon sustainable health. And just to point out that the NDC process provides opportunities to strengthen work in all 3 of these areas. And you'll see that as we move through the presentation. So as I mentioned, I'll be focusing on the WHO guidance that was launched at COP29 last year, titled Quality Criteria for Integrating Health into Nationally Determined Contributions. And we structured this guidance around the general chapters or components that we see in the NDC documents. So the first one is more cross-cutting, but then the rest of them follow the chapters of the NDC document, and we'll cover each of them in turn and identify how health can be integrated into each of these chapters. So as I mentioned, this first set of quality criteria in the guidance are cross-cutting and applied to the overall NDC process and not necessarily to a specific chapter that you would see in the document. Of course, the NDC process differs depending on the country context and the institutional arrangements in your country, but a strong health leadership and supporting environment is critical to meaningful integration of health in NDCs. So ideally, the health contribution is led by the Ministry of Health. And of course, the NDC process is an ongoing process. It doesn't just end with the submission of the document. And it's really crucial that the Ministry of Health is actively engaged in the process on an ongoing basis. This is critical not just for health integration, but also for a commitment to implementation. This active role of the Ministry of Health will also support the integration of climate change considerations in national health planning and programming, which again enhances the likelihood that actions are implemented and sustainable. Also, the NDC process can be a critical opportunity to emphasize that other sectors also have a responsibility to address the health risks of climate change. The NDC process is a really good opportunity to support increased cross-sectoral coordination and policy coherence, and to ensure that other sectors are considering health in their climate change policies to ensure not only that health is being promoted, but to avoid any of those unintended negative health impacts. So this is the first set of criteria that is based on a chapter or a component that we usually see in the NDCs. So most NDC documents will begin with a section that introduces the country's circumstances. It is important to include health in this introduction section of the NDC document to stress that the ultimate goal of successful adaptation mitigation is our health and well-being. So it's suggested that the guiding principle of the NDC is population health and well-being. So describing the health context in the national context sections, this would include health policy priorities and relevant legislation and regulations, helps to elevate the health priorities and to support the integration of health across the NDC components and also across the sectors. Also ensures that the health risks of climate change inform the targets and actions of the NDC across all sectors. And if possible, it's recommended to quantify current and future health risks. And usually that would be done through a climate change and health vulnerability and adaptation assessment to inform those targets and actions of the NDC. And as a very brief example, in the NDC of Indonesia, the NDC points to the Indonesian constitution and particularly that every person shall have the right to enjoy a good and healthy environment. And their NDC really prioritizes climate actions that will improve the quality of life of its citizens. So the second group or area of quality criteria relates to mitigation, the mitigation chapter, which has historically been sort of the bulk, the crux of the NDCs. We have outlined 4 quality criteria and they relate to co-benefits, air pollution targets, and then mitigation actions for the health sector. And I'll go over these in a little bit more detail over each of them. So starting with the health co-benefits quality criteria, it is suggested that the health co-benefits of mitigation actions in other sectors are identified in the NDC and where possible also quantified. So NDCs are mandated to report on co-benefits that are likely to result from mitigation actions across sectors, and health co-benefits of mitigation are recognised across various sectors, including food, agriculture and land use, transport, household energy, and there is very strong evidence for the health co-benefits, and these offer very strong arguments for transformative change. So evidence shows that the public health gains of mitigation actions in other sectors far outweigh the costs of implementing these actions. Identifying and quantifying the health co-benefits can improve decision-making on investments for climate action across all sectors. So it really supports investing in those actions where we can see the greatest health gains, the greatest health co-benefits. And as such, provide really strong arguments for transformative change and increased ambition across the NDC. We do have a presentation coming up in a moment on the tools on estimating health co-benefits of mitigation actions. So I won't go into detail. There's a range of tools to assess, quantify, and monitor co-benefits. This is just a selection of WHO tools. So the speaker will be sharing more in a moment, and we'll share a link to a summary of these in the chat also. And as a really good example, to improve its 2021 NDC, the government of Colombia, along with WHO and PAHO, carried out an analysis to quantify the health and economic co-benefits that arise from increasing the ambition of its NDC. So they used 3 tools to estimate the health co-benefits of reduced air pollution that was associated with the implementation of the actions in their NDC. And this study found that an increased mitigation pathway, which consisted of a carbon dioxide reduction of around 58% by 2030, could prevent more than 3,800 premature deaths annually by 2030 due to this simultaneous reduction in air pollutants. In economic terms, they found that the health gains from, again, this highest mitigation pathway would save around $1.9 million annually. And it was also estimated that the highest mitigation scenario compared to the lower ambition scenario would provide 20% greater economic and health benefits. So these are very strong arguments for climate action, for climate change mitigation in other sectors. It is also recommended that the Ministry of Health works with other sectors to identify and commit to health-based sectoral targets and interventions that have a large potential to reduce air pollution and short-lived climate pollutants in line with the WHO air quality guidelines. So we know that 9 out of 10 people breathe outdoor air that exceeds the guidelines from WHO. Meeting those air quality guideline levels globally could prevent around 80% of premature deaths that are related to PM 2.5 exposure, and of course, at the same time, reduce greenhouse gas emissions, because many air pollutants, carbon dioxide, short-lived climate pollutants, contribute to both climate change and negative health outcomes. So comprehensive mitigation targets should encompass all anthropogenic emissions, not solely carbon dioxide, encompassing these short-lived climate pollutants like methane, hydrofluorocarbons, and black carbon, and integrating standalone reduction targets for air pollution and short-lived climate pollutants could really yield substantial climate and health benefits. For example, in Chile's NDC, they included air quality measures within the NDC, air quality regulations for public and private transport systems, household energy, and the industry sector were included. And these aimed to reduce total black carbon emissions by at least 25% by 2030 compared to their 2016 levels. And the NDC of Chile really takes a holistic approach to mitigation that includes the health sector. And then finally, within this set of quality criteria for mitigation, for the mitigation chapter of the NDC, we look at setting greenhouse gas emissions reduction targets within the health sector. Now, this primarily applies to countries with high health system emissions who should set specific standalone emission reduction targets for their health system. When we're looking at these quality criteria for health system mitigation, we do want to consider the common but differentiated responsibilities and respective capacities principle. Those countries with limited emissions are, of course, recommended to focus on building climate resilience and improving health systems performance, while at the same time considering a low carbon pathway for their health systems where this is feasible, and of course, without compromising quality of care. And in some cases, this means that some national health systems will need to increase their emissions to reach optimal health system performance and to increase their climate resilience. But we do know that there are some synergies with resilience and mitigation actions that can be found. Healthcare costs can be reduced through reduced energy use and optimization of resources, and we can contribute to health co-benefits. But on the other hand, countries with already high-performing health systems with high climate resilience capacity should really be aiming to reach net zero emissions as soon as possible, ideally no later than 2050. And WHO has published a document, Target Setting for Low Carbon Sustainable Health Systems, that provides a little bit more guidance on setting emissions reduction targets for health systems, and the link will also be posted in the chat. So just as a brief example, Sudan's NDC commits to providing solar energy to health centers, and Vietnam's NDC commits to energy saving and energy efficiency measures in hospitals. And these actions, of course, reduce health systems emissions, but also increase resilience by increasing access to energy. Now, as I mentioned, traditionally in the past, NDCs really focused on mitigation. But of course, ensuring health systems and facilities can manage the impacts of climate change and continue to deliver care is essential for reducing the health impacts of climate change. And many countries include an adaptation component within their NDC. And for some countries, particularly those with minimal emissions, this is a really critical component of the NDC. In fact, in a 2023 synthesis that the UNFCCC did of NDCs, it found that 81% of NDCs include an adaptation component. And according to the 2023 WHO assessment of health in NDCs, around 63% of NDCs include health adaptation priorities. So in terms of the quality criteria for this chapter, for this section of the NDC, it is recommended that health is identified and integrated as a priority sector in the NDC, in the adaptation component. And it's also recommended that this adaptation section is fully aligned and continues to support existing national adaptation planning processes and mechanisms, including for health. So this process of alignment will necessarily differ according to country context, but usually would include aligning to the National Adaptation Plan or the Health National Adaptation Plan documents and process. And the priorities, actions, and targets described in all these documents ideally are aligned and provide synergy. Ministries of health and other stakeholders should also work with other sectors to ensure that the health implications, both benefits and potential harms, are considered also in the adaptation component across the relevant sectoral adaptation targets and measures. And as mentioned previously, there are synergies between adaptation and mitigation, and these are often included in the adaptation section of the NDC. So for example, in Laos NDC, they have used the WHO's operational framework for building climate resilient health systems to structure their adaptation targets. They've got a results-oriented health adaptation framework, and they also have health consideration in the adaptation actions of health determining sectors. The next area of the NDC documents that is often included or as a chapter is loss and damage. Now, I again won't go into a lot of detail in this because we do have another colleague who will be presenting on this in a moment. But essentially, when we talk about loss and damage, we are referring to the destructive impacts of climate change that cannot be or have not been avoided by mitigation or adaptation. So there's destructive impacts that go beyond the bounds of adaptation. It's usually divided into two broad categories. So we look at economic losses, which is loss of resources, goods and services typically traded in economic markets, and then also non-economic losses, which is these losses that are not otherwise commonly part of markets. And this can be at the individual level, for example, loss of life, displacement, societal, loss of local knowledge or territory, or environmental, such as biodiversity degradation. So we've outlined 4 quality criteria related to loss and damage and how to integrate health in this chapter. And it's suggested that climate sensitive health risks and outcomes, including those within health systems and facilities, are quantified, that the financial implications of health related loss and damage are quantified where possible, and that the NDC includes priority interventions to avert, minimize, and address loss and damage to health and health systems and facilities. As a specific example, the NDC of St. Kitts and Nevis provides an overview of the economic and non-economic loss and damage that is already occurring in the country due to extreme weather events, and they specify some specific health or loss and damage to health. It includes health infrastructure, the increase of climate sensitive diseases, mental health, and some other examples. And next, and this was also touched on previously, it is important to cost out what will be needed to implement the NDC. And we know that there is a significant health sector finance gap, and that lack of climate finance for health is consistently cited as a barrier to implementation, and it often exacerbates inequalities. So to understand what are the financing needs and to really adequately allocate resources, it's necessary to estimate the cost of the health-related actions that are included in the NDCs. And these estimates should also include other needs for implementation, such as human resources, capacity building, technology transfer and development. In the NDCs, it is also very common to specify the conditionality of climate finance, and this should also apply to the health actions. So meaning those health actions that will only be implemented if international resources are provided or some other conditions are met. And these conditional actions and identified funding gaps can form the foundation of climate change and health funding proposals. And then finally, in this section for finance, given that the health and well-being of populations, communities, and individuals is the ultimate goal, that guiding principle of NDCs, health impacts and indicators should be used as the foundation for prioritizing investments across sectors. So the results of the assessments of climate-sensitive health risks, health co-benefits, health loss and damage, which are recommended in earlier sections throughout the guidance, should be used in prioritization exercises so that we can make sure that the investments that we're making in climate action have clear climate change mitigation or adaptation impact, of course, but also yield the greatest health benefits and likely then better returns on investment. So for example, in Sierra Leone's NDC, the NDC includes an action plan that has indicative costs for all activities, highlights the need for international financing and domestic budget allocation, and specifies the conditionality of each strategy in the action plan. And then finally, implementation. There will be a lot of targets set in the NDC and targets for health, targets that consider health. How practically will these targets be met? What are the actions that we need to undertake to meet the targets? And it is recommended to develop a health sector implementation and capacity building plan. So it is very clear what the health sector needs to do to meet those targets. And that will include translation of relevant national mitigation adaptation targets in other sectors into health sector targets. So for example, some energy targets will also need to be translated to what the health sector needs to achieve towards that target. And then it's recommended, of course, to develop a health sector monitoring and evaluation plan and include health indicators in the overall NDC monitoring and evaluation framework. So to achieve health targets in NDCs, the health sector implementation plan will show us how to achieve the targets. We break down the targets into implementable actions, detail the actions that need to be implemented by the health sector, but also actions that other sectors will need to implement to achieve the health targets. Ecuador's NDC that was submitted in 2019, their first NDC, as a part of this process, Ecuador developed a whole of government NDC implementation plan with 11 sectoral plans, one of which was health. The plan development of the health sector plan was led by the Ministry of Public Health, and it focuses in this case on health adaptation on that section of the NDC. And the plan includes milestones, outputs, domestic funding and international support that's required to implement the NDC and achieve those targets set in the NDC. So finally, just to say that the guidance itself does include some checklists to support implementation of the guidance, and so you can see where either your current NDC is at or what you might need to do to improve the NDC in terms of integrating health into all areas of the NDC. And the attached community of practice, the resource repository specifically offers a lot of resources for each of those sections, each of those chapters of the NDC and the opportunities to integrate health. There's tools and resources, and there's task teams and technical meetings as well. As part of the attached, which can support health integration into NDCs. And that was a brief overview of quite a detailed document. If there are any specific topics, so we have a couple of speakers coming up that you would have seen in the agenda looking at health co-benefits and looking at loss and damage. But if there is any area of this guidance of the process of integrating health and NDCs that you would like further support on, further webinars or training on, please do let us know, and we would be happy to set up another webinar that's maybe more specific, delving into one of those topic areas. So thank you very much for your attention, and I hand back over to Lena.
Thank you very much, Amy, for highlighting some of those critical linkages between health and climate mitigation and adaptations, and also specific ways in which health can be integrated in some of those components of NDCs to protect and improve health through climate action. So as Amy has mentioned, there are many tools available to support these efforts. So now we will hear from Dr. Pierpaolo Mudu from the WHO Regional Office for Europe on tools for estimating health co-benefits of NDCs. Pierpaolo, over to you.
Hello, can you hear me?
Yes.
Okay, I want to share my screen if possible. Okay, can you see my screen now?
Yes.
Okay, thanks everyone for following this webinar. And my name is Pier Mudu and I work for the WHO. I work for the headquarters and for the European Center for Environment and Health that is in Bonn, in Germany. And I have to thank the previous speakers because they set up really the scene for my presentation. That is a quick introduction to a software, to a tool that WHO has developed. It was already mentioned before some results, so my presentation really builds on what was presented before. What we are going to see in these 10 minutes is a tool that is called ClimateCage and how it was developed, how it works, and also some results of the use of this tool. So the first thing that you have to keep in mind that this software was originally developed in Excel in 2018, and at that time was called CarbonAge. And then we rebranded and rebuilt basically the software with the same formulas, with the same routine in 2021. And ClimateCage is a decision aiding tool developed by the WHO European Center for Environment and Health with the aim to screen among carbon mitigation pathways considered by member states in their NDCs proposals for the Paris Agreement. And the software does so by comparing the health and economic co-benefits of climate policies over the near term, because we model until 2030. And the second objective is to encourage users to collect the data that are necessary to carry out a more comprehensive analysis using traditional data-hungry modeling software. And this is an important point because most of the software that are available to do this kind of calculation are quite sophisticated and they really need a lot of different input data. So we have tried to simplify, keeping obviously a scientific rigor, this kind of approach. And the third point is that this ClimateCage is also an educational tool, a didactic tool that can be used in very different places to learn and understanding the logic of health impact assessment and the calculation of co-benefits related to climate change policies. And the other big thing that we have on this software that I'll show you in 2-3 minutes is that there is an emphasis on reduce input data, as I was mentioning before. And there are, for people in the European region, there's that goes from Portugal to Central Asia, including Central Asia, There are data that are available already for using the software. And the level of analysis that can be done with the software goes from a simple analysis to a more advanced analysis. And the software includes not only health impact assessment outcomes, but also economic outcomes. And this is quite a novelty for this kind of software, although it's not a novelty in terms of the work that is done usually by health economists in this area, in this field of work. So the software comes preloaded with country-specific default data that are modifiable by the user, but just at the moment for the European region. We hope, pending availability of funds, to enlarge the availability of data for other regions. And the other point that is important to keep in mind for people that are not use or that don't know this software is that the software, we designed the software, is a Java application that usually run in all computers, that it's a standalone software. You don't need to install it. So you can use it, you can download it and use it in a pen drive. I will show you, I have a slide where I can go a little bit more in detail about this easiness of the use of the software. And the software comes for all the main software platform of computers that are available. So Windows, Macintosh, and Linux. This is the web page of the software, and as I was mentioning before, on the right side of the web page, you see that a download is possible for the different platform. There is a manual available, and I have a dedicated slide on the manual, and there is a survey that the users can do. So here there is the link. It was already, I think, put by Amy before, or by the colleagues on the chat, how you can access the tool that is free, so you don't have to pay anything. There's no fee. You can use it and download it for free. The other aspect that I want to emphasize is the fact that there is a manual that was developed for more. It took a year to have a simple manual. So I suggest people that want to do this kind of calculations to download first the manual, read the manual, and see if they understand the logic of the software, and this fits the purpose of their work. So in the website, there is the manual that I suggest to download first and not to go directly to the software. And there is a user survey that we use also for other software that we have developed. Amy was mentioning HEAT, BarUp, and RQ+. So there's a family of software that WHO has been developing along the years with many different purposes. But Climate Age has been redeveloped recently, as I was mentioning, from Carbon Age, following a kind of user-friendliness approach. So the users are the ones that are in charge, basically, to give us instructions in which is the best way to have the software to be designed for people that do not work regularly, every day, constantly on this matter. And Climate Age has a similar interface to RQ+. For those that are not familiar, RQ+ is another software that does the calculation of the health risk assessment in relation to air pollution. So the graphical user interface wants to give an idea quickly, immediately, to someone that is not familiar with this kind of calculation, giving explanation of what it is expected to see in this software and what can be done with this software. What cannot be done is also listed in the What is Climate Age, for example, a frame text that we have in the welcome screen. There is a glossary where the main keywords and terms are discussed, and the user can organize their projects quite easily. So they can be sorted, they can be exported, and the software has been benefiting from the experience of RQ Plus, that is the most used software in the world for the calculations of the air pollution health impacts, where the feedback of users really shaped the software. That became very popular. And the file, if you download the software, it will be approximately 47 megabytes, and it will go in a folder. It is a zip file, so you need to unzip it, and so you don't need to install it. You just need to unzip it. You can also work on a USB pen. So if you are not the admin of your machine, so if there are problems even in downloading in your machine and doing some changes in your folders, you can use it in a USB pen. It's this is one of the feature of the work that we want to share with you. And the software is organized in two folders, basically, and various documents are in the folder resources, and then they're available when you run the software. So this is, in a nutshell, the welcome of the software. When you download it, when you unzip it, and when you click the exe ClimateCH file. And I have, in the next version, I think we will have the main question that ClimateCH is addressing is that what health and economic co-benefits could be achieved by the implementation of the climate policies in the national determined contribution of a single country, or in a group of country, or in a region. So this is in a nutshell the philosophy of the software. And if we go a little bit more in the detail, we can work in the reduction of emissions of air pollutants from a business as usual scenario in 2030, where we can include particulate matter, fine particulate matter, SO2, so dioxide, sulfur dioxide, NOx, and methane, that you can enter in an emission reduction input for the software. And data, as I was mentioning, can be entered for a single country or region, or for a group of country. And we have, when you work with the software, you will work on the co-benefits of the climate on the NDCs, and you will work basically with the changes in the particulate matter exposure and the health gains and the economic benefits that are related to these changes. So the only input in reality that you require from users in the European region, where we have 54 countries, is the emission reductions, and then the software is preloaded with the necessary default data to do calculations. But all the default values can be modified by the users. This is a logic that we have in all our software. I go quickly to the end, and I decided to end with giving you the examples that you can check about the use of the software outside the European region. And already Amy was mentioning Colombia, and there is a report where we show all the benefits that can come from the NDCs that were declared by the Colombian government. And as Amy was mentioning, it's around 3,800 premature deaths annually avoidable for Colombia, and the economic burden is very, very big. And the case of Colombia, as Amy was mentioning, was done with the need to run different models in order to get the data, to input data. There's another case that we ran, ClimateCH, Carbon H at that time was called, but it's the same formulas. But Excel was a little bit much more complicated to be used. And there are other cases in Pakistan when we calculated the reductions, the greenhouse gases emissions reduction co-benefits. And also there, I think we have explored a case where there was a significant lack of data. So check also their report if you're interested in this kind of estimates. And I conclude my presentation just giving you the fact that the software is being now used much more than we expected, in the sense that there are calculations that were published recently on for the climate change mitigation policies in Ireland. And I want you to point, so you can check how the software was used and see also the discussions around the output and the different, I would say, input that you can put in the software. You can work with mortality, you can work with morbidities data, and also with restricted activity data if you have them. And what is relevant is another article that was out recently from the Lancet Commission. The work done published for Ireland was published 2024, so a year ago, and the same for an article in Lancet, where there is an entire paragraph where the Pathfinder Commission describes the use of climate change. And they also use that for this report that was published. That is a very important report. And check also a publication that was done by the Joint Research Center of the European Commission for the Western Balkans, where there's also a discussion about the use of climate change. So the tool is now used in different assessment and as becoming much more, I would say, widespread than we expected. So when we designed the tool, we were using it, as I was mentioning at the beginning, mainly for educational purposes and for introducing people to this kind of calculations. Now we see that people are using the tool to make estimates, to make calculations. So I really thank you, and I hope you will enjoy the use of this tool if you are interested in this kind of work. Thanks.
Thank you very much, Dr. Muda, for guiding us through the tools available, and particularly the Climate Age tool. Just also confirming that the link to this tool is available in the chat, and we will be sharing the slides after this meeting too, in case any participants need to consult again the details that have been presented. So now we will move on to a presentation from Dr. Ali Ardalan from the Health Systems and Emergencies Lab at WHO, who will outline how it is possible to estimate loss and damage to health. Dr. Ardalan, over to you.
Thank you so much, Olena. I appreciate that. Can you see my screen?
Yes, however, it is not in presentation mode yet.
Now?
Yes.
Okay. Thank you so much for organizing the webinar. It's a super important subject, and thanks for the opportunity to present from actually the health system and health emergency sides of WHO as well. So the part that I want to focus is about the loss and damage assessment in health sector as one of the requirement for all the basically planning processes. So the base of the damage and loss and all the economic evaluation is actually kind of the gap analysis. What was the situation before the event and what after? And the part that actually so far has been the focus of WHO, and I have been involved, was the estimation of the damage and the loss and all those economic basically estimation based on the extreme events, the disasters. However, with like the importance of the climate change nowadays, importance of the slow onset events, what I will present basically can be applied with some consideration into this context as well. One of the usually the big an important issue should be considered is setting the baseline for this type of the gap analysis. Usually for the acute events, acute emergencies, such as floods, kind of the storms, etc. It's difficult, but not that much to set a baseline of what was the situation of the health and health system before that event. But when it comes to the slow onset event, would be more challenging. However, this slide from the UNDRR, UNDP, and WMO joint work, you see that potentially what kind of the timeline can be used. And however, usually we have a slow onset events gradually, and on top of those extreme events such as big floods, storms in any country. There was to basically do this type of the analysis and prepare for the recovery from those extreme events. There is a joint agreement between World Bank, EU, and United Nations, usually mainly coordinated by the UNDP on behalf of the UN, while all the sectors and agencies are involved. On the post-crisis cooperation agreement. And it led to development of the actually strengthening a methodology called DALA, or damage and loss assessment, and then post-disaster needs assessment methodology that has been done thus far in many countries worldwide. And here is the link to that PDNA guideline. And it's a specific chapter for the health that I try to present the part of that damage and loss assessment here in this presentation. So the PDNA methodology includes context analysis, the actual estimation disaster effect, assessing the disaster impact, the defining the based on those recovery needs, and developing a recovery strategy that will lead to recovery framework and detailed action plan and resource mobilization. As I mentioned, the different sectors are involved, and basically the key four include productive, social, the four categories actually, productive, social, infrastructure, and cross-cutting. Health is actually along with housing, education, and culture under the social category, and having basically health among others also can be potential opportunity for addressing basically the interdependency of the health to other sectors for any adaptation and mitigation and recovery plan. So what are damages and loss? In very simple language, whatever is related to the physics and infrastructure, we'll discuss it under the damage, and the rest would be like functions, etc., will be under the loss estimation. So the actually refer to the destruction, to the total or partial destruction of infrastructure and physical assets of the health system. The costing is based on the replacing, is estimated the replacing or repairing market prices prevailing just before that extreme event. And the damage is actually valued first in physical terms, and then will be translated to the monetary value. So it's a kind of the economic estimation can be done. For the loss, actually, it's related to the change in the economic flow. And that can be because of the extra cost that the health system is paying to address that event, or because of some of the loss of the revenue that health system used to have, but because of that event is interrupted. So the economic loss refers to the changes in economic flows arising from the disaster. The duration actually varies. These changes usually continue until the achievement of full economic recovery and reconstruction, and in some cases lasting for several years. Here, I may mention that these extreme events sometimes can happen in the related to climate change or not, can happen in the countries with protracted emergencies that have been in actually violent conflict situation for decades. Evaluation is expressed in current monetary values. So if I wanted to summarize, basically, so the damage is related to destruction of infrastructures and assets. The loss can be addressed actually to whatever, as I said, non-physical, and can be related to the governance and the decision-making processes of addressing that event, addressing disruption of services and increased health needs, and or actually reducing increased risk to health. So examples of the governance and the decision-making includes whatever coordination mechanism or emergency response processes are needed, increased cost of the disaster-related information and the surveillance system. Disruption of the services basically can be related to, for instance, stopping all the surgeries that have been done in health facilities, in the actually radiology centers, etc., etc., and reducing the increased risk to health, whatever extra financial support expenditure needed to, for instance, address the new outbreak, foodborne or vector-borne, and any other type of the environmental type of the risks. When we discuss about non-physical part of the actually effects of the slow onset or extreme events, that can be economic or non-economic. Here you see some basically elaboration on the economic damage and loss due to the slow onset event. For instance, under the infrastructure, the slow onset event usually don't lead to destruction of the health infrastructure and assets. However, we need to invest on the health facilities resilient to climate change. Health service utilization can be increased because of the change in the burden of disease attributable to a slow onset event. Governance and decision making, however, need extra financial support to develop and implement climate change adaptation plans for the health sector. And of course, always we advocate to be integrated in the disaster, health emergency and disaster risk management and the health security plans and initiatives. And that potentially also needs additional monitoring and surveillance system to support adaptation to climate change. Managing to the risk to health, again, increased cost adapting to changes in transmission, patterns of the vector-borne diseases, environmental risk, and potential outbreaks or epidemics. And increased risk to care for patients with chronic and acute malnutrition, if defined as attributed to the SOE. In addition to those that can be, and we want to translate to monetary value, there are some effects that actually are considered as non-economic. Can be in the health sector because of the increasing burden of disease, or delays, or like a disruption in meeting and achieving the SDGs or any specific national health development plan and goals. Here I want to emphasize that the burden, the extra burden of disease related to the both extreme event and slow onset, not all of them will be extra cost to the health system, because it doesn't mean that all the those patients will refer to the system, and the system needs to pay for the treatments. However, in longer term, it would be a extra cost, and I would say economic impact for the country in large. Ami and other previous speakers somehow, Ami directly and others alluded to regarding that all the activities that being done, for instance, addressing the climate change, actually is an opportunity for us to improve the resilience of the health system. This is also the very similar to what we refer to as the build back better in the recovery from the extreme events. And for instance, when it comes to the facilities, applying the climate resilient health facilities or modernizing the facilities to be more resilient to the climate change impacts. However, the Build Back Better can address many other opportunities, like possible pre-existing constraints in the coverage and performance of the service delivery. Strengthen the epidemic early warning, surveillance, and response, and improving all hazard risk management capacity at the national and sub-national level. So that was I would say introduction to the damage and loss estimation, and I would happy to respond to any question. And I hope my colleague Dr. Andre Grieksburg also is on call. He just retired from the WHO and basically has been leading this work for, I would say, more than 1 decade. Thank you, and over to you.
Thank you very much, Dr. Ardalan, for outlining these key areas and approaches to estimate loss and damage to health, both in economic and non-economic terms, which, as we know, is an important component of integrating health in NDCs. So now that we have obtained this overview of available tools and approaches to integrate health in NDCs, we will move on to a presentation of a country experience from Nepal, from Mr. Rajaram Poteshwecha from the WHO Country Office in Nepal. Rajaram, the floor is all yours.
Yeah. Good morning, good afternoon, and good evening. Good evening. Can you hear me?
Yes, we
Hello.
can hear you, and now we can see you.
Okay, thank you. Thank you very much. Yeah. So, first of all, thanks to the organizing team for giving this opportunity to share the country experience. And at the same time, also apology that Dr. Samira Adhikari from Ministry of the Health and Population could not share this country experience due to some other engagements happening at this time. And I'm happy to share the country experience on behalf of this whole Ministry of the Health and Population, and also as well as from the WHO. So slides are not moving. Yeah. So you may know that Nepal lies between China and India, and Nepal also is a very unique country in terms of the geography, with just about 60 meters from the sea level up to 8,848. That is the Mount Everest, which is the highest peak of the world. But Nepal has been witnessing the increased annual maximum as well as the minimum temperature in all areas in the mountain, hill, and terrain. So, and moreover, the recent report published by the ICMOD shows that the target of limiting 1.5 degrees centigrade is or the means about the 2.5 degrees centigrade in this Hindukush region. So that shows that this 1.2 degrees centigrade is too hot for Nepal. And because of this, country has been witnessing the several impacts of the climate change in all sectors. So we have the several incidents of a climate-induced disaster, glacier lakes outburst, depletion of water sources, malnutrition, challenges in the food security. But we know that ultimate impact is on health. And we also have some evidences. We carried out some researches, and we also conducted a vulnerability assessment of the health sector. So this graph also shows that is just one of the example about the increased cases of the dengue in Nepal. The first case was detected in 2004, but over the years, after 20 years, we have the more than the 50,000 cases every year in Nepal, even in the mountain region. So with this background, WHO has been consistently supporting government of Nepal, and especially Ministry of Health and Population. The support includes the all 6 building blocks in terms of building capacity of the health professionals in addressing the health impacts of the climate change. It also related with the vulnerability and assessment. And also at the facility level, we have been piloting climate-sensitive disease surveillance. And also we have been working on the climate resilience and environmental sustainability of the healthcare facility in different parts of the country. But when we see that our support and activities of the Ministry of the Health in climate change, basically these are focused on the adaptation. So we do have the Health National Adaptation Plan, a National Adaptation Plan, a National Health Sector Strategic Plan, as well as the Mali Declaration and some other WHO resolutions. In past, basically all these resolution and the policy documents have focused on the adaptation measures. But over the years, we realized that we also think about low carbon health system in the country. And around COP26, government of Nepal, as part of this commitment to the UNFCCC, submitted a second NDC, and also at the same time developed a long-term strategy for the net zero emission. When we see these documents, in these documents, health was hardly reflected. In second edition, there were 2 targets. I'll come later on. But in the long-term strategy, health sector was somehow missed. But good thing is that just before the COP26, Minister of Health and Population made health commitments at COP26 on that. And as a result, Now we have the updated vulnerability and adaptation assessment, followed by updated health national adaptation plan for the period up to 2023 up to the 2030. It is the cost plan with 5 strategic objectives. So, and as a result, also Nepal carried out baseline assessment of the greenhouse gas emission of the health sector with the support from the WHO headquarters, regional office, as well as from the Healthcare Without Harm. So now we have the figures on the emission from the health sector, and that is 4.1% of the overall country's emission. So, and after that, we started advocating for integrating health component in the overall NDC process. So then, as Amy mentioned, that definitely we follow this quality criteria for integrating health in the NDC, and gradually we started advocating following this quality criteria. So definitely, Ministry of the Health and Population led the overall NDC 3 process with technical and financial support from the WHO. We advocated integration of the health into overall NDC process. I remember that Health Secretary, in presence of the Honorable Minister of the Environment, advocated for the integration. And at the same time, in the different forum at the provincial level, at the federal level, and also during the meeting with UNCT, UNRCU meeting, there was a strong lobbying and advocacy from WHO and from the Minister of the Health to include health component in the overall NDC3 process. So as a result, yes, it is there now. We're happy to inform you that. And WHO has been supporting on health component as a lead agency to the Ministry of Health and Population. And at the same time, we have also coordinating, collaborating with some other sectors like WAS, energy, agriculture, to include health issue related with these sectors. So, and good things as part of this development of the NDC3 is that to some extent we have this information, quantified information that's limited, that's not sufficient. But again, in Nepal, we carried out this baseline assessment of the GHG emission, and also we have this costed and also with a quantified target after this health national adaptation plan. So at this moment, this draft NDC3 is open for the public comments through Ministry of the Health. We also provided some very specific comments to incorporate in this during the finalization of this NDC3. So it is under the finalization process. So when we compare the components of the health in second NDC, in third NDC, I must say that there is a significant progress. So in the second NDC, there is only one target related with the mitigation. It's about the use of this non-bond technology for healthcare waste management in 1,400 healthcare facilities. And also there is another adaptation related target under development of the climate sensitivity surveillance program. So there were only 2 targets in the NDC second. But now in NDC 3, we proposed 11 very specific targets, and most of them have been considered in draft document. Some of them are similar to what we have proposed, and some of them have been merged with some other sectors like the solarization part with the energy sectors and some waste related activities with the waste sector like this one. So now in this draft NDC 3, under the adaptation, under the mitigation, as well as under the policies and measures, we propose some very specific health-based targets. So they are based on the country's commitments, government's the policies, also as well as the in line with the ongoing activities. And good to note that as several other speakers also mentioned about the importance of the addressing this air pollution. So we also feel this is a very important topic in Nepal, because very often Kathmandu has been projected as one of the most polluted cities And we know that every year in Nepal, more than 40,000 people have been dying only due to that is air pollution. And this is one of the areas which is the off track to the SDC. So because of this, we set the target related with the SDC, and the target about this 77 per 100,000 mortality rate. That is in line with the government's target in the NDC. So yes, we have good progress, but at the same time, it's not enough as compared to the overall health impacts of this climate change. But at the same time, I also have to mention here that the guiding document from the global team itself talks about basically about the energy, waste, transport, and offload. There is no specific heading such as the health. So because of that, it is very difficult. But at the same time, we have been advocating, and now the health part has been considered under the others. And also, while setting the health-based targets, it's a real challenge for us to have these quantified health targets. And we know that only that is quantified and with the good baseline information, then we can propose this health-based targets, and that will be included in that is in this document. Another challenge is that multi-sector collaboration within the health sector as well as the beyond the health sector. So, for example, when we talk about this air pollution, in order to meet and in order to achieve this target, definitely we have to have the good collaboration with energy, transport, construction, agriculture, and some other sectors. And definitely there is a limited resources for the implementation after this NDC implementation plan. When we see the second NDC implementation plan, the total estimated cost is about 33 billion. That is not available in the country. And while developing this NDC 3, definitely we calculated some unconditional from the government side, and there are many activities that we have been considered under that conditional support. So the next forward is definitely is the finalization of the report. Hopefully the government has committed that it will finalize in the mid-May, and that will be shared in the Sagarmata Samvad that is happening in the 16th of May. Then definitely next step will be the development of this implementation plan. And resource mobilization, it's a big challenge. So definitely this kind of forum will help Nepal and several other developing countries to mobilize the resources for achieving this target that set in the NDC. And definitely we must also have the good collaboration and work together with several other sectors for the effective implementation of this plan. Thank you. Thank you very much.
Thank you very much, Rajaram, for articulating how this integration of health and NDCs can be operationalized really at national level through your efforts in Nepal. So hopefully this has been helpful to illustrate this process for other countries and stakeholders who are connected as well today. So now we will move over to a discussion session, which will be shorter than we had initially planned, but we do encourage you to raise any comments and questions, and the discussion will be facilitated by Elena Villalobos-Prats, who is the Country Support and Capacity Building Lead at Climate Change and Health Unit at WHO. Elena, over to you.
Thank you very much, Lena, and thanks to all the presenters for these excellent presentations and insights. I would like to have an easy job to do, so I'm kindly inviting all of you to basically raise your hands if you have any question to address to any of the panelists or in general. Feel free also to basically share any of the experiences or challenges that you are facing in your respective countries. And I'm very happy to see that there are many country participants here that are interested in doing more to integrate health within the NDC. So please, I would invite all of you to start raising your hands If not, I may raise some of the questions that have been shared in the chat. Maybe I start by the point raised and the question by one of the participants, basically requesting the WHO investment case on climate change and health. And I think this is relevant because basically there you can find some data that can be used at country level on, for example, the effectiveness of some of the interventions that can be used also to build a case for the integration of health targets within the NDC. And in this case, you will find, for example, more related to air pollution, which is relevant, and even something related to resilience and the use of climate-informed health early warning systems. I see that participants are being shy. Again, I see that there are many participants from many countries. I know that Ethiopia, Lebanon, Pakistan, Turkey are connected. So I think the most interesting would be for you all to basically share your experiences. I cannot see any hand raised. So maybe I just, if I don't hear from anybody, I will. Rudolf, please. Anadunya from Ethiopia. Please, Rudolf, go first.
Yeah, thank you very much for this insightful webinar. I have been working on climate resilient health systems as part of my PhD. And then I just noticed a few things at the national level, national in the country, policy programs. I noticed that this is explicitly stated. There's a form of commitment. However, I do notice that there's always a disconnect, especially in low and middle income countries, from national agenda and the local level. So I am really interested in experiences or possibly a guidance that will kind of move that national commitment to the sub-national level, especially at the primary healthcare level. For me, this remains very critical to any success that we can do. And then number two, I have also noticed that the issue of mainstreaming, it's very important, but it's usually kind of, well, not too explicit. We just mention it and there are no these clear processes towards it. So tied to funding, I am wondering whether the opportunity in country doesn't exist to mainstream. Whilst we mainstream this into primary healthcare, then we also ask development partners, that is state and non-state actors, to also mainstream this. And probably this can create a window of opportunity for some level of funding, so that we can reduce the external reliance on international funding for these. So for me, these are very critical issues that I think that we need to go forward and look at a way of this or share much more best experiences around this.
There's one additional question. Where are you based? Which is your country?
I am based in Ghana.
Ghana.
Yes, I'm based in Ghana.
So, Dr. Bunyaba Abanga, thank you very much for these remarks, and also congratulations on your PhD in this important area of work. I think your 2 points are quite important. Basically, how to connect what is happening at national level with what has to happen at local level. And here we have lots of colleagues working in countries, including from WHO. So we will make sure that those experiences are properly shared and that potentially additional guidance, maybe case studies on how this has done, can be shared also with you. So please be in contact with us. I see that Dr. Gemeda from Ethiopia, you have also a question or a comment?
Thank you very much, Elena. Can you hear me?
Yes, perfectly.
Thank you very much. I would like to congratulate WHO for organizing this important webinar. Really, it was an opportunity for us to learn which tools are already developed and which guidelines are already there. I think WHO is ahead of everything. It's not only including health in climate issues. There are a lot of documents. That means there is a strong team on the ground working on knowledge. Yeah, we know WHO is knowledge hub always. So you proved that climate change and health is moving forward. So today I'm very much delighted in attending this session. When it was postponed, I was a bit terrified. You are going to cancel it, but I'm happy we managed to gain a lot of things. Having said that, I would like to say, maybe I don't know, our level of engagement at country level, some of the experts may be embraced in the Ministry of Health system. I'm based in Public Health Institute, and I'm engaged in most of climate and health issues, like giving training, involved with the African CDC. There are a lot of platforms. When it comes to this NDC, I think this time, maybe the gathering, the coming COP may be opening an opportunity for creating a platform to bring people at national level to the same forum, and they can contribute. And they can even cascade what WHO is trying and strengthening countries. Having said that, I'd like to be brief. Related to this NDC, really it is tough to estimate the health impacts, whether it is economic or non-economic. So how can we, DALIs, it may be a jargon for people who are in the policy, in decision making, when we are presenting. For scientists, it is okay. You can use DALIs or whatever terms, they are always available there. So I'm a bit challenged about how to estimate and familiarize ourselves in the health sector for decision makers, the impact, the number of diseases, the number of illnesses. These are something which are, sometimes sensitive when you report for some of the diseases. So really, I need your intervention. Which estimation tool are more convenient for decision makers who are coming from various levels in terms of understanding the health challenges? And in another aspect, they are most of the time they are focusing on economic issues, the GDP, all those things are how the youth who's expected to be productive is affected, age disaggregated, gender disaggregated. All those things are making sense for some of the decision makers. So I'm a bit challenged in how we have to move forward. Thank you very much.
Thank you very much, Dr. Gemeda, and all your interventions, I think, are going to be very useful in designing the next round of the webinar series on NDCs that my colleague Amy is putting together. So basically, on the national platforms, we fully agree with you. This is part of WHO's efforts to really bring together the existing capacities at country level, the knowledge that is already there in ministries of health, in the research institutions at country level, and leverage that and strengthen that to be able to continue using that in the future, including for the integration of health within the NDCs. And the second one, again, my colleague Pier Paolo has already presented one of the specific tool. We may do more to make sure that the existing tools, the scope and how to use that and which are the outputs of the specific tools is easily understood and accessed. So thank you very much. I have two more interventions and then I will just invite my boss, Yarmit, to close the meeting. So, Emin, please go ahead.
Hi everyone. This is Didem Evci Kiraz. I am from Turkey. I have a role in UNDP of Turkey as a climate adaptation health sector expert. As Turkey, we have prepared our national climate adaptation strategy and action plan until 2023. And also we finished vulnerability and risk assessment, analysis and assessment plans. In addition, we worked in 4 pilot provinces. We have completed the vulnerability and risk analysis of them. In all of them, public health was included as a special section. In other words, climate and health vulnerability risk analysis and adaptation actions of Turkey and 4 provinces are ready. These studies will ensure that Turkey's NDC is very strong in terms of health, and health needs to be integrated into the NDC more strongly. I think NDCs are more mitigation oriented. Compliance should also find a place in the NDCs. Adaptations should also find a place in the NDCs because adaptations equals health. Thank you very much.
Thank you very much, Dr. Emin, and congratulations for the progress made in Turkey. Just to reiterate and to echo what you've said, both mitigation and adaptation are important, and both should be integrated into the NDCs. Lastly, I'm very happy to see Dr. Malkawi, and then please go ahead and share your...
Thanks a lot. I hope you hear me well. I spent some time of my life with WHO, with the team of climate change and health, and it happened that I was part of the team who did the Pakistan analysis, and I know, sorry to say it, how difficult it is. It's not as easy as we imagine. It needs some data, and I'm now spent 3-4 months in United Arab Emirates, which is a rich country, resourceful country. But I can assure you that the capacity is lacking. The Ministry of Health cannot do it. They need training. They need experts or consultants, to do this. That's one thing. The other thing, the NDC is manipulated by the UNFCCC focal point. And that focal point is managing all the sectors. It's trying to keep a balance between health and the other sector. Hardly we convince them that health is an issue, and now it is part of the NDC, but we don't have a free space, to put everything in that exercise. I don't want to be negative, but these things that we need to take care while doing it. We are putting the final touches on the HNAP for Emirates, and hardly we could put a figure, because of data. It's mostly qualitative rather than quantitative. We're trying to say that this will increase, that will increase, but which will not put us in a place to do the qualitative assessment or the estimation of the burden. Sorry to take much of your time. Back to you.
This was excellent, Masen, and I think it's very important to highlight that if countries go for a quantitative approach to estimating basically potential health gains from integrating health in mitigation policies and options, it is quite time and resource intensive. So depending on where they are, the budget that they have, the capacity that they have, they may go for a qualitative approach. And also depending on the time that they have to do this. With this, I think that's it from our side. And I think I just invite the army to close the webinar. Thank you.
Thanks, Elena, and thanks to all of you who have stayed till the end of what I think you'll agree has been a really rich, content-rich discussion. I know we and the other co-presenters have thrown a lot of information at you, but hopefully it's clear that there is a lot of work now going on in this area. As we said at the beginning, when we looked just a couple of years ago at the coverage of health within NDCs, we were in a very much weaker position than we are now. And I think what we collectively have been able to do is to show you that there is a strong rationale for including health in the NDCs. There is the technical support to back up countries that want to do this. There are the tools there, and there are successful examples of where it has been done and is already having an influence on policy. And all of this has just been achieved just within the last few years. Having said that, I just want to reflect a little bit on the comments that were made from the participants at the end, which I thought were really helpful. Of course, I like the one that said WHO is ahead of everything. That's very kind of you to say that, but also combining those with the comments from our colleague and friend Mazen Malkawi, now working in the UAE. WHO is often, we work quite hard to get into the position that we are able to say what should be done, what the ideal why it should be done, the objectives that we're all looking for, but actually getting it done is another story. And as Mazen has alluded to, it takes engagement from national governments, not just within the health sector, but also within the ministries which are in charge of the overall NDC process to welcome health in. It takes capacity building and training to support health actors to engage in this, because it is still a relatively new issue to most of us, if we're honest. And then it often takes takes data and analytical expertise if we want to do a quantitative assessment. So we're absolutely not saying, well, this is the end of the story. Here is how you do it. Now go away and do it. We're also here in the long run to support countries to make that journey, which many countries are now starting to make. Maybe the last point I would make is that it's really important that we do this together, because as Mazen was alluding to, it's a heavy lift for individual countries to do it, but it gets easier if you're able to learn from other countries. Even, I would suggest, to the extent of knowing roughly what scale of benefit we think that we would get in a particular country, because other countries have already done this analysis. So we can also share information and move forward in a stronger way and in a faster way by working together. And of course, that's one of the reasons that we set up the ATTACH, the Alliance Transformative Action on Climate and Health, in order to support countries to work together and also to support partners to come together to support them as efficiently as possible. So with that, I'll just once again reiterate my thanks to the presenters who have presented here, the WHO team which has run this, Amy, Elena and colleagues, but particularly to all of you who have participated in this discussion, and we'll look forward to continuing to work with you on this in the future. So with that, I'll close the meeting. Thank you once again.